there is a significant influx of private equity money into the healthcare space. And with the portfolio concept we talked about earlier, not all that's going to be successful. We all remember the influx of private equity money into the PP physician practice management roll-ups that happened in the 90s. And we're trying to avoid those lessons today. But is there anything from a private equity perspective that is particularly interesting to you, or a cautionary note from your perspective?
You know, what I would say is that when we are contacted by private equity, a lot of what we have to do is to start by doing some education, because they hear medical devices and they think, oh, 10, 12, 15 years. That's not necessarily true. So what we hear is that they're primarily interested in something that they want to balance their portfolio, right? Mm-hmm. But they're not looking for long-term investments. They're definitely looking for more short.
That's right.
I mean, you're lucky if you get a midterm, right? So what I say to any private equity entity, individual, is I'm not going to waste your time. If I don't have something that isn't going to bring you a return in 2 to 4 years, I'm not going to even bring it to your attention. So if I call you, I have something for you. Otherwise, you're not going to hear from me. So for us, David, it hasn't necessarily been like, I'm really interested in orthopedics, or I'm really interested in neuro. It's been more about the return on investment and how quickly they're going to have that. That's been my experience.
Mm-hmm. Yeah. Well, I would say I can't disagree. I think private equity, just overall, it's doing something that is probably needed, driving innovation, right? You're unlocking things, you're adding a lot of ideas into the market, a lot of dollars into the market. But the key thing is there's definitely a return attached to that.
There
right?
is.
And so that just has to be aligned with where you're going already. Right. And I think that's where we really do focus on that. We do some business with private equity for sure, but it's already got to be aligned with our core mission. And I think I love your approach. It's like, okay, I'm only going to bring you things that I know fit your need. They come at us, we're very much the same way. So I definitely, I'm thankful for private equity. I'm thankful for, look how much has changed, the telehealth advancements, all of that stuff. That wouldn't have happened without it. But you got to have alignment.
Yeah. Dr. Brown, anything from your perspective?
I think you're spot on with that comment. I probably remain the biggest skeptic on the couch. Private equity, particularly when it comes into care delivery models.
Oh, yes.
You've referenced.
Oh, yes.
We all got burned the first time around with practice management models. The fundamental is they want a return. That return's coming out of healthcare. It's coming out of the healthcare dollar.
That's right.
And we're going to spend X number of dollars on patient care. We ought to try to save as much of that money and spend it on patients and not extract it out of the system. So I remain interested.
Professionally curious, let's call it.
Professionally curious. Thank you.
I think that's great.